I'm speaking with Urvashi Butalia. She's the director of Zubaan, which is a publishing house that showcases the voices of women from South Asia. Urvashi, thank you so much for taking the time to speak with SPF today.
Thank you. I'm pleased to be here.
I'd like to start with kind of a very basic question. Since you're right now in Delhi, I just wanted to check in and see how are you doing amidst the COVID-19 pandemic, and kind of what is the situation around you at the moment?
Yeah, the situation around us is not very good. As you probably know, we've just begun to open up after 4 phases of a very strict lockdown. And the lockdown was imposed with very little notice, 4 hours of notice. And that led to a lot of confusion and a lot of insecurity. And also what happened was that many industries had to shut down overnight. The workforce that they employ is by and large informal migrant workers. And what happened was that suddenly overnight, thousands, millions of people were out of work. That led to a huge amount of distress, poverty. Not only were they out of work, but their landlords threw them out because they don't have savings to be able to pay. And that is why you saw such a lot of migration from Delhi of workers who had nowhere to go. Not only Delhi, but all the big cities. So there was distress, poverty, etc. And that was really tragic. And now that we've started to open up, there's even more confusion because while people recognize the need to restart the economy, cases are surging in India. You know, they're really on the rise. So people don't know whether to go out, whether to go to work, how safe it is, what is going to happen. And all the time we've been waiting for the curve to flatten, but it hasn't yet flattened. So I don't really know what will happen, but people are hoping that things will calm down after a while. One of the encouraging things is, touch wood, that the death rate in India is quite low as compared with other parts of the world. And there's all speculation that the virus has mutated and is not as harmful, but this is all speculation. In terms of our own work as publishers, that too has been very deeply impacted because with shops and establishments closing down, all the bookshops had to close, so there was nowhere people could buy books. Printers had to shut down, and supply lines, which are often between the printer and the publisher, which often cross state boundaries. Those were broken, and if a state is ruled by a different political party than the center, then that makes it even worse. So that too has been badly impacted. So the situation's not good, but we're hoping that things will improve. One can only hope, really.
So I wonder if you could speak a bit specifically about how you see this pandemic affecting women in particular.
I'm glad you asked that question. So where women are concerned, it's become very apparent that they have suffered in very specific ways as a result of the pandemic and the lockdown. As in many other countries, the levels of domestic violence have risen as people are locked inside homes 24/7. And they don't have the valves that would let off pressure earlier. For example, going out and sitting with the community or somebody going out of the house for a few hours to work. And because India is by and large a poor country, so the homes are really small and people are in cramped spaces together. That has led to rise in domestic violence. And the difficulty that women face is that it is almost impossible to report that domestic violence. Partly because women have far fewer cell phones than men do in India. It's like 38% or something. And partly also because the helpline services that are there to respond to complaints of domestic violence have been suspended because of the medical emergency. Mm-hmm. Then about 75% of our care workers, which includes nurses in hospitals, but also village level workers who provide help to people in villages, they are all women, about 75% are women. They are extremely vulnerable to infection at this time because they are the ones who are in contact with patients a lot, and they are the ones who have to go from village to village, say distributing sanitary pads or food and so on and so forth. So they are extremely vulnerable. A whole range of other things have happened in terms of women's livelihoods, for example, India's about 90% of India's economy is serviced by the workers in the informal sector workers, who are people who have no contract, whose jobs are extremely vulnerable, they have no job security, and who are mostly migrant labor. Women form large numbers of this. And even though we have an Equal Remuneration Act in place, but women get paid much less than men do, especially in the informal sector. So when jobs fall apart, then it is the women who are much more vulnerable, because they are the ones who people get rid of first. So at this moment, both men and women are out of jobs, but women have been much more deeply impacted because one, they've lost whatever little economic livelihood they had, and two, their burden of care inside the home has increased hugely. Other than that, maternal and sexual health services, such as access to abortions, which is a right women have fought for in India, such as just being able to give birth in safety, such as other sexual health issues for which you might need to consult a doctor, all these are suspended at the moment of the pandemic. So women are suffering as a result of this as well. Contraceptive services, the manufacture of contraceptives has been impacted because manufacturing units have closed down, because contraceptives raw materials are sourced in one place and they are manufactured in another place, and those systems don't exist. That impacts women's sexual health. So there's long-term impacts also.
And given this outsized impact on women due to this ongoing pandemic, do you see a specific role for women in contending with the pandemic or dealing with the aftermath? Or in addition, do you see a role for the feminist movement in this context?
Yes, absolutely. So the feminist movement in India has been actually really quite at the forefront of raising issues about women and pointing to things that the state might have forgotten. So for example, in the first bits of news that we got about migrant labor having to leave, and many felt so vulnerable that they were walking thousands of miles to their homes, and you had these tragic pictures of thousands and thousands of people walking, poor people walking, hungry, without water, without food. It was women's groups that pointed out to the media that there were also women among them, but they never actually were visible because all attention was focused on the men. So not to say that the men were not vulnerable, but really that it's important to notice that there are also women workers. Then very early on, women's groups in Delhi, the city where I live, wrote a letter to the Chief Minister of Delhi asking him to pay attention to women's particular vulnerabilities in the time of the pandemic, and saying to him that there is still time, please put a plan in place, please put a budget aside. Then the feminist movement has also been working on the ground to provide relief to women, and they are the ones who make sure that relief packages, for example, also have sanitary products in them which women might need, because if you're locked inside your home, where can you go to buy sanitary pads and things like that? So that too, women's groups have been doing. And they have been doing the important task of a lot of data collection and information on the ground in the absence of any systematic exercise doing that. So, and also, for example, women's groups have gone to court. There's a group that took the Indian government to court, demanding that the government provide ambulances for pregnant women who needed to go to give birth, because all ambulances were put aside for COVID patients. So all of these things have been happening as a result of the feminist movement.
So now I'd like to pivot our conversation a bit toward some of the work that you've been doing in collaboration with the Asia Peace Initiatives Department of the Sasakawa Peace Foundation. So Zubaan and SPF have been working together on a full range of different initiatives, and these include things such as providing grants for young researchers and writers in Northeast India, as well as publishing books and a range of other projects. And more recently, you've been working to organize an art festival called Through Her Lens. So I wonder if you could talk a bit about that project specifically and tell us how things have been taking shape amidst the ongoing pandemic.
Yeah, thank you. We've been working, as you know, with the Sasakawa Peace Foundation for several years, and the work is largely focused in the northeastern states of India, which are states, there are 8 states, and then there's a whole region extending outside the Northeast, which are ethnically and racially similar. So we take those into our ambit as well. And these are people and states which are marginalized in the mainstream discourse in India. So our attempt has been really to work with artists, writers, poets, theater performers, and others in the states, and young scholars. So there are many initiatives, and this one particular initiative that you're mentioning, Through Her Lens, grows directly out of the COVID pandemic. So we, as Zubaan, are knowledge producers and knowledge curators and knowledge disseminators. That is our role in the movement. And we feel it's very important that a history of the movement is created and that there is solid documentation of moments like this, which can enable us to learn from the experience of women on the ground in future times. So in an attempt to do this, Zubaan put in place a project called Through Her Lens, which is largely a visual project, and which basically asks women photographers, young amateur photographers, as well as more experienced ones in the northeastern states, to visually document through photographs the impact of the lockdown that is happening as a result of the COVID-19 pandemic. So what is happening to the domestic space? What is happening to women in the domestic space? And it's a very interesting thing because it's also photographing intimate lives. You know, so you're the daughter who might be photographing the mother. So it tries to cross that barrier as well. And these photographs are then curated into regular exhibitions, which take place every week. And we have also had a number of webinars around those exhibitions in which young photographers are put together with more experienced photographers. And we discuss the practice of photography, the ethics around it, and so on. As well, Zubaan has worked through SPF and the Asia Peace Initiative and with some other groups. We worked in the Northeast with women on the ground who are living through COVID in collecting their stories. So village level workers who are distributing relief will go and collect stories. And these stories then are documented and put together with the photographs and also on their own as a really valuable archive and documentation of what is happening at this time of crisis.
And what are some of the larger impacts or more long-term impacts you're hoping will come from this kind of project? Or what are your plans for the future moving forward?
Yeah, I think there is always, whatever project one does always fits into a larger frame, which we hope has a life beyond just that moment. So for us at this moment, collecting women's stories, working at the intersection of art, photography, activism, to not let women's voices be lost is very, very important, because we feel that at moments like this, if the crisis takes over, the voices of those who are most vulnerable kind of disappear. So it's our responsibility, we feel, to keep those voices alive, which is why when we look at women, we will also look at the most vulnerable among them. So the poorest of the poor, the ones who are disabled, the ones who cannot access state assistance because they are at a distance from where it is available. All of these things are important for us. And so one thing is to collect that information, to have that documentation, to put it into a space which contains a history of what happens to women. The other is to use the learnings from that information to communicate with people at a policy level. And that too we do by engaging in larger conversations and by engaging not necessarily directly with the state, but with actors who have the power to influence the state. And we make this knowledge available to them and emphasize to them also the importance of things that are usually marginalized and not seen as feeding into policy or not seen as valuable for policy, which are things like art, like stories, like women's writings, like the pictures we are collecting. So through her lens is one aspect of this which tries to document photography. And already actually it has received a lot of attention, and it is growing because we've had interest from Nepal in working together with them on photography. We've had interest from various other people in other parts of India to do similar projects. So you can see that it has also a kind of impact where it's rolling out into much more work. So I hope it's valuable in a variety of ways for the present and also for the future.